Let's bring in Dr. James Hamblin now. He's a lecturer at the Yale School of Public Health. He's also a staff writer and co-host of Social Distance podcast at The Atlantic. Dr. Hamblin, welcome. Thank you so much for joining us. You know, we just heard Ben tell us that the president will take his final dose of remdesivir tonight. That is something also we learned from his doctors yesterday when they were describing his dismissal from the hospital. For our viewers who don't know, remdesivir is an antiviral drug. So is what we've heard described the typical course of this drug when treating COVID-19?
Yeah, I think we're still kind of figuring out exactly what the optimal use cases for this drug are, because the disease is new and so is the drug. But this is not an atypical pattern, and they've said from the beginning the plan was to deliver 5 days. So it doesn't seem that anything is being adjusted in a way that would suggest a change in the president's clinical status.
All right, I also want to show you some video from last night, which shows President Trump on the White House balcony of the South Lawn. This was just after he arrived from Walter Reed. So, of course, without reading into it too much, it does appear that his breathing is perhaps more labored than usual. Granted, he just walked up a flight of stairs. That could wind the best of us. But based on what we know about the president's treatment, how might this virus have affected his lungs?
Yeah, well, the virus replicates really well and quickly inside of tissue in our lungs. It causes inflammation. It impedes our ability to exchange oxygen. And we know, at least from the reports we've gotten from the president's physicians, that he very recently has had some reportedly minor issues with that. So it's not at all surprising if indeed he was winded here, that he would have that sort of symptom while in the throes of this illness. And we still don't know when he was infected. We have not had transparency around testing issues, and that's a big question. But as best we're told, he would still be in a phase of this disease where it could go many different directions, and we would not expect that he could be expected to have zero symptoms,
right
at this point.
Is it worrying for a patient of the president's, sort of size and age who is having a little bit of difficulty breathing, perhaps with his lungs, which we're largely assuming, on the basis of the fact that the doctors are not willing to share information with us? Is that a worrying sign?
What's actually worrying is the fact that Americans are speculating about something like that because they feel the need to, because they've not felt there was a reliable, honest accounting going on from the president's doctors. I'm not suggesting anyone was lying, but they have clearly said they do not want to mention results that are at all abnormal, even the ones that don't sound concerning. Just kind of give the top line and say that the president is fine. And so even when you can believe that story, and I tend to believe the overall read on the situation is accurate, but the unwillingness to share seemingly inconsequential details just because they appear, less than perfect, it has created a lot of just really undue uncertainty right now that is unnecessary. And really ideally you'd have a physician who could just come lay out the facts and, the good and the bad, and help people understand this disease in this critical moment for our country.
Absolutely. And, of course, doctor, we can assume the president's team of doctors will be monitoring his vitals very closely in the coming days and weeks. So, for a patient who's now received this additional oxygen twice and has been on this experimental cocktail of antibody drugs, what would you still have questions about in terms of his care? And what's the most important thing that you'd be monitoring at this juncture? Again, in terms of timeline, we don't know exactly which day we're on from when he was first infected, but it's my understanding that by day 7, that's really where you need to keep a close eye. Is that correct?
Yeah, the timeline should not be as unclear as it is, but roughly around there is where people start to transition from this phase where symptoms are caused by the replication of the virus itself to a phase where symptoms might be caused by a hyperactive immune system. And that's where things can get variable, where some people are having The most common thing is respiratory symptoms and low oxygen levels, but other things like blood clots and cardiac symptoms. That's why his doctors are monitoring everything. This could still go in a lot of directions. He's being treated with a steroid to try to, minimize that possibility. You just ideally you're watching everything and catching any sign of declining really quickly.
And Doctor, your most recent podcast for The Atlantic focused on the upcoming months, particularly if we are ready for a potential resurgence in the winter. So Doctor, are we ready, or should we all buckle down and prepare for the worst?
I think we absolutely need to prepare for the worst. I'm not saying it will happen, but right now we're about 40,000 cases a day. And, Dr. Fauci said a month ago that by this point we should be about 10,000 cases a day. So we're well above that. Past pandemics of respiratory viruses surge during the winter. People are being forced indoors. Schools are reopening. Restaurants in New York and elsewhere are reopening indoors. And so there's this confluence of factors, in addition to complacency and messages from the president minimizing the threat of the virus, that all come together to suggest that there will be another surge during the winter. The question is just how bad will it be?
So we need to prepare for the worst. And what should we all be doing? Doctor, we hear the social distancing, the face masks. If we are in an area that is seeing a slight uptick, are there additional precautions we should be taking?
Yeah, I think the key thing is not to assume that just because your area is not being hit hard currently that you should stop doing those basic measures. This is a virus that we do not have immunity to, that is not leaving us. And as we saw with spread around the country so far, over the course of the spring and summer, it tends to be spreading before we realize it. And many places are not testing as widely as we should be. And so everyone should just behave as though you are contagious. If
Right.
people are able to continue working from home, that would be great. If people are able to avoid things, even when they become legal and allowed locally, it doesn't mean that the virus is gone.
Right. I think that's great advice. Behave as if you are contagious. It does have a tendency, this virus, to sneak up on us, just when we think we're out of the woods. Well, Dr. James Hamblin, thank you so much for joining us. We really appreciate it.
Thank you for having me.